What if your biggest workforce expense isn't payroll? What if it's burnout? You see, most leaders think burnout is an employee well-being issue, but it's not. Burnout is actually a performance issue, a retention issue, a productivity issue, a leadership issue, and a financial issue. It is a systems issue, not just an individual well-being issue. And the reason for this is I've seen statistics that show burnout impacts turnover. It impacts engagement levels of professionals. It also impacts absenteeism because employees who are exhausted, questioning if they can keep doing the job they're doing, they're going to call out, or they're going to call out because they're sick, right? When we're burnt out and we've been functioning in that chronic stress state for so long, it takes a toll on our body. And a lot of people who never would get sick all the time. So they're going to be absent. That also leads to increased healthcare costs. So if your organization is seeing health insurance premiums rise, yes, there's other factors because that's just what's going on in the industry. But I would challenge you to look at, does the cost increase because you have employees who are now seeing the doctor more or developing chronic illness. And so those things increase insurance costs. And I would almost guarantee we could tie that back to those employees are probably burnt out. Burnout also impacts patient outcomes because if a professional is burnt out, they're not able to critically think to the best they can for that patient. Their ability to connect with their patients declines, and so client outcomes decline. We have to protect our employees and those providing the service because they're the ones that take care of the clients, right? And so I want to talk a little bit about the culture capacity equation. This is when culture determines capacity. And capacity determines performance. So what I mean by that is if you have a culture in your organization where everybody is negative, there's a lot of cynical comments going on, I would question, are people fulfilling their roles, right? Do they have the mental capacity, the physical capacity, the energy capacity to fulfill their role to the highest potential that they started with? And when capacity determines performance, right? If we don't have the energy capacity or the mental bandwidth, performance is going to decline because what usually takes 10 minutes is going to take 30 now. So we have to recognize that one thing leads into the other all the time. It's not just one isolated situation. It's chronic stress repeated over time is what we're talking about. So when culture erodes capacity, that's when burnout becomes expensive for your organization. And so as we talk through today's conversation, I want you to think about your own team. And I want you to ask yourself some questions. Are people exhausted more than they used to be? Are you seeing turnover increasing in your organization? And how about, are your managers stretched thin? So are you asking them to do more than they used to? And where is that decision coming from? Is it a way to try and save money by putting more work on people? And the last question I want you to think about as we go through today's conversation is, does everything feel harder than it used to or than it should? Right? Because at one point, if capacity is declining of what one person can handle, then what used to feel easy now feels hard. And so as we go through today, if you're seeing these patterns in yourself or your organization, I encourage you to take the organizational burnout assessment. I created this as a way to recognize early warning signs that something's starting to erode and shift in your company. It's designed as an organizational diagnostic tool and leadership insights tool so that you can get a clearer picture of where your organization sits. So you can start to create a plan to overcome that. And so I'll explain more about that later in this video. But I want to first share a story. So I used to work for a psychiatric hospital. And when I walked in to the facility, took the job, it was in worse shape than I was told. right? People were burnt out. People were calling out. The capacity for the facility was 92 beds to be full. We couldn't get census over 60. And as an organization, I know you understand what that statistic means, right? You have a lot of open beds, which is a lot of income. But when there's a lot of staffing instability and burnout is increasing, we can't keep expecting more admissions because the facility, the milieu was not stable for new kids, for new individuals, right? And so we were forced to hold admissions temporarily because things were not going well. There were some situations and things that shouldn't have happened, right? And that's, I truly attribute that to we did not have a stable facility and stable staffing. And so while we were on hold, right, there's always a lot of assumptions. We just have a staffing problem. So we need more staff so we can fill more beds. But the reality was we had a burnout problem and a systems problem and a culture problem. We had three problems, right? Staff were burnt out because they were constantly responding to crisis after crisis. There was no calm down period. It was one situation after another, taking people away from their jobs, taking leaders away from their jobs to help try and calm the milieu down. And that's a problem, right? You can't keep functioning that way long term without losing employees. And that's where the culture was shifting because a lot of people were very negative about being at work. And that's going to flow into the patients they were trying to support, that they were there to help. They genuinely cared about helping. And it became a systems problem because leaders weren't understanding that. Leaders just saw people not doing their job, or they saw we need more staff when we needed to slow down for a moment so that we could get a handle on what was going on. And the consequences were high, right? Because when you can't admit more people and you might be discharging a few, that's a financial loss. The workforce was very unstable. And how do you work through that? Because workforce needs to know that where they're working, they're supported and that they're not going to be expected to do more if the capacity is not there. And leadership was strained because leadership couldn't lead. They were on the floor helping support all these crisis situations that were happening. But things turned around when we stopped treating the symptoms and started addressing the root causes, right? And so in this particular example, we slowed things down. We worked more on training staff. We helped calm the units and talked about how to engage people and clients to prevent some of these crisis situations from happening. And we addressed that root cause. We readjusted the structure because sometimes the structure isn't about what we have always done. It's about what does the population and the facility need now. And it's about adjusting to that so that the needs are getting met because you see the needs weren't being met. So when we can focus on those needs, right, we can address those root causes. And this is why burnout isn't just a people problem, but it is a business issue. Businesses have to look at the structure of their organization and they have to ask, okay, are we doing this because it's truly what's most beneficial and effective now? Or are we doing this because it's what we've always done? And if the answer is it's because it's what we've always done, I encourage you to question that. Question if there's a better way that is more effective and reduces the stress on everybody, including you, because I know if your people are stressed, you're probably stressed if you're the leader. But you see, the things that leaders can see is the cost. So as a leader, you might not see that staff are burnt out, but you're going to see turnover increasing because you see that in the numbers. You see that in how much you have to spend on recruiting costs. And you see what you're spending on onboarding, right? Because onboarding costs more, typically costs twice as much to onboard a new person than it does to put effort into supporting somebody that's already there doing a good job. Training costs increase, right? Onboarding somebody new requires more time training, which is more time from the leader doing their job. They have to put extra time into training. The other cost that you might see as a leader is, are you seeing more absenteeism? And I saw this a lot as a leader where staff who used to never get sick were constantly sick. They had doctor's appointments. They would come in with a head cold, something that never happened before. Or are you seeing more call outs, right? People call out because they're sick. People call out because they need a mental health day. And I would almost guarantee that those call outs for mental health day are because they're burnt out. They're trying to regulate their stress and they know they just can't handle anything for the day. Other absenteeism issues cause schedule disruptions, right? Because now the front desk has more work because they have to reschedule all these people. And so, how does that flow impact them? The other cost to burnout is it reduces productivity, which means if an employee is trying to function under a state of chronic stress or they're burnt out and they're starting to question, can I keep going? If they are not able to make decisions very effectively and quickly, they are slower to execute their duties, right? And a great example I use is trying to do chart notes. If it used to take somebody 5 minutes and now they're struggling to formulate their sentences and what they want to put in the chart, that could take them 20 minutes now or longer because the brain is tired. Their brain says, I need a break, right? Reduced productivity also shows up in missed opportunities, meaning some details are not paid attention to. And they might be important ones, right? Bypassing an email that was important. It might have been an opportunity that you didn't recognize as an opportunity, and that goes for you too. There is a cost when people are burnt out. And that's why I created the sustainable workforce method, because creating workforce stability begins with understanding the root cause, right? Leaders often miss the root causes. We talked about some, but let's talk about a few more. Presenteeism. So if staff are physically present, are they mentally present and engaged? Because that's a difference, right? You want and you need people who show up, not just physically show up, but who are mentally there, excited to be there, and focused and have the energy and the mental capacity to do the work. We don't always notice as leaders when employees are struggling with decision fatigue. So if they're slower to problem solve, they take longer to think, or you might see more mistakes. We need to check in on what they're experiencing, right? There might be reduced innovation. So if your company thrives on innovation and coming up with new ideas, what happens when employees stop contributing those ideas, right? Because a burned out brain can't be creative. It does not have the bandwidth for creativity. It has not recovered from other things it's had to do. It also becomes a contagion, emotional contagion, meaning if a couple of people are stressed and they're putting off this stress energy, this negative energy, or they've even started to become cynical because that happens when people have been in a state of chronic stress for too long. It starts to spread like wildfire through the team. And you don't want the whole team becoming negative or cynical, right? We tend to feel, especially those in the healthcare field, we can feel other people's emotions pretty heavily. And if that's stress and burnout, we don't want that to spread. There's also the leadership drain where managers spend more time managing problems than doing their job, right? This is what I might call the firefighter manager because it's every situation now is a crisis and they have to jump and manage the problem in the moment instead of leading and guiding. And so, how is that healthy for your organization? You see, these are ways and costs of having employees and a staff and a culture that's burnt out. And that's where it is a burnout or a culture problem, right? Burnout becomes the culture problem because it can be contagious. Teams model after each other. I've seen this before. People modeled. I tried to give people time on a Friday to do paperwork, and instead of sticking around to do their paperwork, they left. Especially if I had left because I'd already worked 60 hours in 4 days. People model each other. And we have to be cautious of that. We would hope they're not. We hope they have integrity and professionalism. But if people are burnt out, they're going to model. And when everything feels chronic, everybody in the organization starts to react the same way. That's what I saw in the hospital I worked at. Everybody treated every situation like a crisis, whether it was a true crisis or not. And sometimes we have to redefine what's a true crisis, right? And I think that caters to this immediate gratification culture we have right now in society. I want it now. I need the information now. I can't wait. And that is not true because an effective organization distinguishes between a true crisis and encouraging people to be patient. It's okay to wait. And as we're trying to develop that, right, we want to reduce the impact of an unsafe environment. So we want more psychological safety in the organization where people feel safe. Because if that's not there, there's fewer conversations going on. And I've watched people hide in their office when they used to come out and hang out in the hall for a few minutes or around the break room, have lunch together, check in for 5 minutes in between appointments. And now they don't. They just stay in an office and they quit engaging. There's also less collaboration, and all of that happens because they no longer feel there's psychological safety in the organization. And as a leader, it's so important to pay attention to that and make sure you're creating an environment that is safe. Because the true cost is your high performers are going to be the first ones to leave, right? The high performers are the ones who are always there. They're absorbing the workload that comes. They're probably the yes people, right? They don't say no very often because they want to help. And they have high productivity and turnaround on projects. But they're also going to be the first ones to burn out and probably leave, right? And this is what we're talking about with the culture capacity equation, because if you have a healthy culture and you're supporting individuals with where they're at mentally, emotionally, and physically, they're going to have the capacity and they're going to continue to have high performance. But one area eroding is going to impact the other areas. And so you might be asking, what do high performing organizations do differently in order to maintain their workforce and provide that still stability, right? And that's where they engage with the sustainable workforce method. This is a 4-step process I've developed to help organizations thrive. The first step is an organizational assessment where we can determine what's truly going on and figure out what those root causes are. Because when you change the root cause of the dysfunction, you change the entire organization. And this is exactly what I watched with the hospital I worked at. When we got to the root cause of why we were not stable and why it was constant crisis mode, then we knew where we could fix it, right? And from there, there's 3 directions that we go. And oftentimes we're going to go there simultaneously. One is, how are your organizations leading? How are your leaders leading? What is the structure in your organization and the expectations? And for healthcare organizations, we connect this to the laws and rules, right? And how those policies and procedures are in place. Sometimes we can make small tweaks that have a huge impact, but we have to look at that and look at how all of that structure from the top down is working. The third step is we work on that team cohesion. So we work to rebuild your teams to where they're communicating effectively. And when they're stressed, they can still communicate and feel heard, because a workforce that feels heard enjoys where they work. But when they feel like their voice doesn't matter, they're going to start thinking about leaving. They're not going to be happy. Team cohesion is yes, it's team building, It's communication. It's how do we collaborate, right? We have to rebuild teams. And then that fourth place is resilience. It's a resilience training. It's about the individual person in each position. Because while this is a systems problem, there are things that individuals can do for themselves to manage stress, to function at work, and still go home and recover for the day. So we can't discount that piece, but it is not the only important piece. And so remember, through the sustainable workforce method, what we're working on is burnout prevention as your system strategy, not just a resiliency program. Resilience is important, but we got to work on the system strategy too. And the cost of waiting is often high turnover. You're going to have more people burnt out. And in the healthcare field, this is a high statistic of people leaving the field altogether. And I don't know about you, but in our healthcare field, we don't have enough workers to begin with, that I don't want to see more leave the field entirely and do something completely different. We also have greater leadership strain when we put this off for too long. And I would have you think about how much more can your leaders take on and the reduced performance, right? Because the important takeaway here is burnout is easier to prevent than it is to recover. And on an individual level, it's a 2-year recovery process to fully recover. I've walked through it and I've walked other clients through it. So if we focus on prevention in your system, you're going to be ahead of a lot of people. And so that is why I created the burnout assessment. And that's what I mentioned earlier, right? Because most organizations don't realize how much burnout is costing them until they're already paying the price. You don't see it until you see the financial impact. And I want to encourage you, let's start looking at the other factors before it hits the budget. And so if you take the burnout assessment, it's linked below. You're going to identify your key risk factors in your organization to know where are you most at risk for your organization having burnout. You're going to understand your workforce vulnerability. So where are your staff vulnerable? And then based on where you score, you're going to receive practical next steps on how to either start to turn burnout around or start to prevent it. Because this is the first step in the sustainable workforce method. And if you stick around and you subscribe, in the next video, we're going to talk about why burned out teams stop caring. We're going to answer questions like, why does engagement drop? Why does morale decline? And why do good employees emotionally check out? Because the truth is, burnout isn't just hurting the people in your organization, it's quietly impacting your culture, your performance, your retention, and your bottom line. The good news is that burnout is measurable, it's predictable, and preventable. So start by taking the organizational burnout assessment and identify where risk may be already showing up in your organization.